Do you have a recurring boil or pus discharge near your anus that just won't go away? Or maybe you have had an abscess that was drained but then came back again and again. You could be dealing with something called an anal fistula. And don't worry, you are not alone. I am Dr. Amit Goswami, a laparoscopic and bariatric surgeon practicing in Gurgaon with over 2 decades of experience, and today I will help you understand exactly what is an anal fistula, why it happens, and how to identify it early. But before we dive in, a small favor. I have noticed that over 90% of our regular viewers haven't subscribed yet. If you are watching, please consider subscribing. It's free, and moreover, it helps us to reach more people who need answers to sensitive health questions, just like this one. So now, what is an anal fistula? Let's start with the basics. Anal fistula, also known as fistula in ano, is a small tunnel that forms between the inside of your anus or rectum and the skin around it. But why would a tunnel like that form in the first place? Usually, it starts with an anal abscess. That's a collection of pus caused by an infection in one of the small anal glands. When the abscess drains, either on its own or after surgery, the tract it leaves behind sometimes doesn't close completely. This forms the fistula. So, in simple terms, an anal fistula is the leftover tunnel after an infection under the skin has burst or been treated with. Why does it happen? The primary cause is an infection in the anal glands, but other factors can include Crohn's disease or other form of inflammatory bowel disease, tuberculosis or trauma to the anal region, previous anal surgery, etc. Rarely, it may even be linked to cancer, though that's much less common. The infection leads to pus formation, which in turn leads to abscess. If not treated properly, or if the infection is deep, it can form a tract that's your fistula. Fistulas are classified based on how they pass through the muscles of the anus, mainly the sphincter muscles that are present surrounding the anus. Here are two common types. Intersphincteric fistula. This is the most common type, running between the internal and external sphincter muscles. Second one is transsphincteric fistula. This one passes through both the sphincter muscles, making it more complex. There are other more complicated types as well, but these two make up the majority of cases. How do you know if you might have an anal fistula? Recurring pain and swelling near the anus. Second is pus or bloody discharge from a small opening near the anal area. Number 3, irritation and itching of the skin. Sometimes fever, especially if an abscess is present. You may also notice a small opening near the anus that leads fluid. If left untreated, the tract can worsen or branch out. Treatment and role of surgery. Now, unfortunately, fistulas don't heal of their own. The definitive treatment is surgical. Depending on the type and complexity of the fistula, different procedures may be used. Fistulectomy for simple fistulas, set-on placement, it's a thread for more complex ones. Lift procedure or laser surgery, it's an advanced technique for preserving the sphincter function. The goal is to remove the fistula tract while preserving the continence and healing the infection for good. If you or someone you know is dealing with any of these symptoms, please don't ignore them. Early treatment can prevent complications and improve the quality of life. And if you found this video helpful, please do me a small favor, like the video, share it with someone who might need it, and subscribe to the channel. Your support helps us bring honest, clear health content to more people who need it. Thank you for watching.